Welcome to the Parkland Report. My name is Seamus Reilly. Joining me today, Pamela Everett, a licensed massage therapist and program manager for our massage therapy program here at Parkland College. Welcome to the Parkland Report.
Hi, Seamus.
All right, so tell me a little bit first about the background and history of massage. Where does it come from? Where did it originate? Who first started doing massage?
Well, you know, we really can't take credit for that in the United States, unfortunately. It comes all the way really from the Chinese, and a lot of it deals with Chinese medicine. There's a lot of energy work, and really you can look far as back into Egypt that people were doing massage. People call it alternative medicine, but if you think about it, it's part of the original medicine. If you really think about it, it's been done before we had doctors. People were doing massage, you know. So.
Tell me a little bit about the massage program here at Parkland College.
Well, a lot of interesting things are going on in our program. We've been here for 12 years. We're currently educating our 12th year of class of students, and we're accepting people for class 13, so that's exciting. We have a 100% pass rate, so that's nice for the national exam. We really push them hard. It's 3 semesters, and what we have new is that students have the option to come in, they can get a certificate, and that's what we've been doing all this time, or they could come in and take another semester and get an associate's in applied science, which is nice because they can piggyback that on and connect it to a bachelor's degree or a master's or something else. Yeah.
Do you find that you have a mixture of students who are brand new to the college experience and looking to go get a certificate in massage therapy, and also some students who are like already working in the workplace, trying to add this on as an additional skill?
Yes, I do. We see a lot of that. You would be surprised. We get a large range of age. Some students will come in straight out of high school because they'll do some of the prerequisites in the summer. And then we have people that are just sort of doing another career, or they think they're going to add this on to something they're already doing. It really is a nice thing where you can put it with another career. You think, I'm going to do this for part-time, or, you know, it's just a peaceful, loving career. So I like it.
So when people think about massage, you know, there's a sort of stereotype, you know, you grab, you massage somebody's neck or shoulders or whatever. But there's a lot of science involved in doing massage. Tell me about some of the things students have to know and learn about.
Well, yes, you're right. People think, and we get that a lot. People think, oh, that should be easy. All I have to do is rub people, right? You know, it's a lot of science behind it. If I am working with a client or the student is working with a client, you really have to look at the entire system of the body. There could be other things that are affecting whatever the issue the client is having. So you want to know the body system. So they do take a Bio 111 at least, so they can go through all of the systems of the body, so they have that background. And then when they get into the program, they do a musculoskeletal anatomy class, which really focuses on origin, insertion, action, and basically how the body functions and how would you palpate that as a result, like what's going on here. So someone can come in and they can have an issue with their neck, but it really could stem, you know, further down the low back, and it could have the hip involved or even the knee. You know, we're really connected, and when there's one issue, the body just responds trying to take care of the body, and it affects the other parts of the body. So it's so interesting to me.
Part of the other interesting thing about working with somebody in a massage situation is that you really have to understand a little bit more about what the person is dealing with, either in terms of pain management or as a medical history, or what particular things they've going on. So you have to really understand what's happening with the patient and then react to that particular patient.
Yes, you do. So you do have to be smart about pathology, and we do have pathology in the program. So if a person has some issues, you'd really have to work with their doctor, meaning you could tell them to get a referral from their doctor if they have some conditions to make sure it's still okay to give massage. There are contraindications for massage at times that you would actually be doing harm instead of helping, and our whole goal is to help. So
So a lot of times, again, people think about massage therapy in terms of stress management or relaxation, but in actual fact, there are some specific therapeutic benefits of massage in addition to a relaxation and stress-free environment for at least 30 minutes. Talk a little bit about how massage actually works to prepare, for example, athletes or recovery of muscle tissue.
Yes, massage, the list is so long, the benefits of massage. But as far as athletes go, what happens is we are helping the body go back to what the state of norm is after you've really taken a lot of, like you've done a lot of pounding, you've done a lot of working with the muscles. If you're working, let's say you're preparing for the marathon that we're getting ready to have here. If you're working with a massage therapist, the whole time out, you can be quicker in recovery after you finish with something as big as working toward 26 miles, you know. So you're going to work with them, and they can work with you to just make sure that you have maintenance and that you can continue to do what you want to do. I've had people come to me and go, you know, I've been doing a high level of athletic performance for a time, and it feels like my body is changing, and it feels like the doctor is basically thinking I should stop doing this. And that's a really hard thing to tell a person to stop doing something they love. So if you're working with a massage therapist that is skilled in these areas and help with injuries and things like that, you really can make your life in a sport longer, recovery time quicker. It's just so many benefits to having that. So you can, you know, work at a higher level. So it's nice.
Well, it's always great to see you and great to learn about the massage therapy program here at Parkland College. And thanks so much for being here today on the Parkland Report.
Thank you for having us.
We'll be right back after this short break.
Catch live, play-by-play coverage of Parkland sports. Live the action live. CobraSports.net.
Welcome back to the Parkland Report. I'm joined now by some graduates of the Parkland College Massage Therapy Program. Kristen, Emily, Cheryl, Eric, and Pamela. Kristen, I'm going to ask all of you to introduce yourself and talk a little bit about where you work.
My name is Kristen Fredline, and I work at a chiropractic office in Champaign, advanced chiropractic with Dr. Adam Clodney. My modality is mostly physical therapy. We're getting a lot of runners in this week with the U of I marathon going on, or the Champaign Marathon. So that's about
good.
My name is Emily Scott. I work at Tuscola Pain and Wellness. It's a chiropractic clinic down in Tuscola, Illinois. I'm also a TA here at Parkland in the massage therapy program as well. I really focus a lot on specific work and deep tissue. We get a lot of people with chronic back pain and that kind of stuff at a chiropractic clinic. So I love working at the place that I work at. It's a really good job. So.
Very good. Cheryl.
I am Cheryl Louviere, working at Green Yoga Spa in downtown Urbana. We're a collection of independent massage therapists covering quite a range of modality, from prenatal ashiatsu, which is a broad, deep compression on the body. We have one-on-one yoga instruction as therapy. We have a naturopathic physician in our offices a few days a week, and classic relaxation Swedish, because there are a lot of stressed people out there.
Eric.
Hi, I'm Eric Beckley, and I'm working out of Bodywork Associates. We do neuromuscular therapy there, and that's pretty much kind of along the same lines of physical therapy, specific work Emily and Kristen have talked about. Try to figure out chronic pain problems, and we also do a relaxing massage as well.
Sure. And Pamela.
I'm Pamela Shelley, owner of Am Spa Massage, located in the Old Church Square, formerly the Robeson Building in downtown Champaign. And I provide a Swedish therapeutic client-focused massage. It's very specific to what my client is needing at that time.
So Pamela, tell me a little bit about when you graduated. When did you graduate from the program, and what kind of foundation did the program give you?
I graduated in 2006, and the foundation that the program provided me was one of being able to actually go out and start doing massage as soon as I was licensed by the state, since that is a requirement in Illinois. I was able to provide a very thorough Swedish massage and then incorporate modalities such as hot stone and deep tissue into that as I progressed in my skills.
How much of that sort of different modality training had you gotten here at Parkland?
Quite a bit. The program allows for several hundred hours of actual hands-on as well as classroom-style training. We end up doing actually massage on each other on the weekends, and we end up in clinicals where you're doing 3 massages a night on members of the community.
And did you do you continue to do continuous sort of education as far as training?
Most definitely. It's required by the state to continue to hold on to my license. We're required to have 24 community CEUs, continue education units, over a 2-year period. So yes, for massage therapists licensed in the state of Illinois, that is a requirement.
So Eric, for you working at Bodywork Associates, a very specific sort of type of massage focused on pain management, pain control, specific injuries?
Yeah, knowledge of anatomy, the muscles, and then the nervous system, and just kind of how it all relates. There's a lot of mysteries in it still, but definitely Parkland, like, you know, Pamela said, you felt like no stranger to other things. You were given the Swedish massage protocol, and you could definitely, and you were given so many hours that you really felt competent and experienced in it. But then, yeah, other modalities you don't feel a stranger to at all because you've been exposed to them, they've talked about them, and you also know a lot about the history and why really massage is where it is now. And
as a therapist, do you begin to grow into a particular modality or particular type of use of massage?
I think you do. As I was going, I had a lot of instructors tell me, wow, you really kind of like this anatomy stuff. You like being specific with your work. You know, and they said that Doug Nelson's, you know, Bodywork Associates, at the time he and I were talking, he said, that might be a good fit for you. And it's really been interesting. You know, we've had a colloquium, and we had Dr. Shaw from the Mayo Clinic come over and tell us all about what they know, because they've been researching trigger points, and they can find them now if they use ultrasound with a vibrational sort of component, and they can try to treat them and everything. They've only really focused on the upper trapezius, but at the end of this we had almost 2 days with this man, and you know, he tells us all about the science of it, and somebody at the end just raised their hand and said, so should we still just kind of keep doing what we're doing? He said, yeah. If anything, we're just proving there's some validity to it. So, yeah.
Cheryl, it sounds like you've got a very interesting kind of holistic, comprehensive sort of approach to massage, including prenatal, I think you mentioned. Talk a little bit about the way in which you use therapy in your work to sort of holistically treat the human body.
Okay. Probably I would go back to shortly after graduation, and, you know, being new to the community of healthcare providers, I found that there are so many people who really want massage, and so what we graduate with at Parkland is a very solid, it's truly just a really solid protocol approach to getting people to a state of relaxation. And then the body can also take over and kick in and do what it needs to do. So we're definitely addressing the central nervous system as much as specific issues. And so with that in mind, I really like the idea of encouraging people to tap into a number of realms of wellness. So, you know, exercise and lifestyle. And so the naturopathic doctor, you know, reminds people about diet and lifestyle along with getting some really good treatment of the muscular system and the central.
And really, it seems to me that like part of what your center is working with is sort of massage as an ongoing part of a daily lifestyle, as opposed to sort of a particular therapy or treatment for a situation, either chronic or emergency.
There's certainly a mixture. So a lot of us do some specific work as well, but definitely I have a lot of very regular clients, and I think they see the benefit, and it's prevention, you know, that ounce of prevention, and so they see the benefit of getting regular care, reminding themselves to slow down a little bit, and talking about trigger points that Eric was discussing, the whole notion of some of the relaxation work can prevent some of those trigger points from building up. But then we lead very busy lives, all of us, so the trigger points, they get there, and so you need someone who's very skilled and working specific as well.
Emily, how did you figure out what it was that you were good at as you were going through the program? Was it a natural, or was it an aha moment? You came in one day and you went, you know, this is where I'm at here.
I no, not really. I mean, it was just kind of a combination of a lot of things, just like during school, kind of realizing that I really wanted to focus more on like specific work and working in kind of a medical environment. I've also worked at a spa, and that was a wonderful experience, but I just really, it's just a really good experience to be able to go in with a client and, you know, work with them over a period of weeks or months and really just see improvement in an injury, whether it's, you know, a current injury or an old injury, and it's just really, it's really good for me to be able to see that improvement, and that's just really, just kind of over the course of my career, just being able to see that has really what has brought me to where I am now, of really enjoying what I'm doing.
So you get that sort of satisfaction of seeing somebody kind of limp in and then sort of like a couple of weeks later be able to walk out. But do you get a lot of sort of return clients on a sort of a preventative sort of basis?
Yeah, definitely. Like Cheryl was talking about, I have quite a few regular clientele, and just that preventing that injury from coming back. And I had some people for the marathon as well, and wanting to get ready for that, and people doing exercises and that kind of stuff, really wanting to make sure that they don't injure themselves in the future. It's a good thing.
So Kristen, you'd mentioned sort of like working with sort of like athletes. Is that a particular area of the population you work with?
Yes, I enjoy that the most. Like Emily, I work for a chiropractor, so we see a lot of back pain, neck pain, and I like to focus on the neck and the anatomy with the neck. I like that feeling of the curing, the feeling of a clinic and them coming in and having issues, and we need to see Kristen and to feel better. I just like that. I like that part about my job, and I like seeing all my regulars and the clients that come in, and but I do see a lot of, I enter in a lot of physical therapy modality in my field. So.
Of course, with athletes, it's always good because it's job security, right? Because they're constantly hurting themselves.
Injuring themselves, yes. Especially, I've seen a lot of CrossFit, too.
Yes.
So that's a new thing. But yeah, it's definitely a lot of athletic. And I like to be athletic as well, so I like that crowd.
Have you noticed an uptick in the numbers of people who are now participating in athletic events with, like, say, something like the Illinois Marathon here?
Yes. Yes, I just dealt with that yesterday, the last minute not being able to run. And I'm like, okay, calm down. We'll get you fixed. It's okay. And they're actually going to try and at least walk it. So, yes, I do see a lot of that, especially the week before.
Yes. Pamela, I'm interested in you've been graduated from the program for a while, and you have your own business.
Yeah.
Was that something that you came into the program thinking someday I want to own my own business, or did it just happen naturally?
It just happened naturally. I knew this was something I wanted to do. I also have a full-time job. So I came in it as a part-time option, as far as it being something that I would do along with holding my regular position, because at my point in life I need insurance and benefits. And when I started, I just started within my residence doing it. And one day I just decided, all right, Pamela, is this going to be a career or is it going to be a hobby? I decided it was going to be a career for me. I stepped out on faith, got an office, and hung out my come and be de-stressed sign. Less stressed.
Be less stressed. De-stressed. Yes. And has it been a good experience for you owning your own business?
It's been a very good experience. It's challenging in that our community of Champaign-Urbana, people might not even, looking at us sitting here right now, the five of us, they might be even thinking, oh my gosh, I didn't even realize we had this much massage therapy going on in this community. But Champaign-Urbana is very good to massage therapists, in my opinion. Very good. So yeah, it's been nice.
Well, I want to thank you all for being here today. It's been a real wonderful experience getting to know you, and I wish you very good luck with your careers and keep making people feel better. Thank you for everything that you do.
Thank you.
Thank you.
We'll be right back after this short break.
What can your phone do?
I'm enrolled in the dual credit AYES program. I'm currently taking electronic control and advanced engine performance and chassis electrical systems. Tell your friends about dual credit. It's a great program.
Welcome back to the Parkland Report. Joining me now are some current students in the Parkland College Massage Therapy Program. I'm going to start on the end. Brad, go ahead and introduce yourself.
Hi, my name's Brad Veach. I've been doing the massage therapy program for this past year now. I really enjoy it.
Excellent.
My name's Stephanie Keith, and I have also been doing the program. Started in the fall, and I am going for my associates in it.
My name is Vangel Kasapov. Just like them, I'm doing massage therapy, but I'm also a minor in kinesiology, and I'm going to get my certificate.
Okay.
I'm Kelsey. I am in the massage program since August, like everybody else, and I am doing my associate's degree in massage.
So, Kelsey, it's a one-year program, but really you have now the option of going on to complete the associates. What made you think about doing the associate's degree?
I decided to do the associate's degree because I like that I can build on to it. There's other things that I like to do along with massage, so this is a good foundation.
What possible things do you think you could combine it with?
I'm going to do physical therapy, and then I'd also like to do nutrition.
Excellent. Vangel, what attracted you to the massage therapy program in the first place?
Well, at first, I kind of just wanted to help people out, mostly my family, but anybody that's basically around me. And then as I progressed, at first, when I got into the program, I wanted to do sports massage. But as I progressed through the classes and learn new things, I want to focus on more detail work and basically helping everybody out that I massage.
Okay. Stephanie, what
Brought me into this?
Yeah.
I actually am a cosmetologist, so
Okay.
I wanted to build on what I currently do and be able to help out my clients and offer them more variety of options and services.
So now explain to me a little bit more about how massage therapy might work in a cosmetology setting.
Just the relaxation part of it, because I do hair,
Right.
pedicures, manicures, and then being able to, and facials, and being able to offer them relaxation massage would be wonderful.
So one of the things I notice when I go get my hair cut now is that they do a little scalp massage when they're actually shampooing the hair, and part of that, but then also you could build in some sort of neck massage, facial massage, understanding how to work to relax your client.
Yes, actually, as a cosmetologist, you learn the scalp, the facial, all of those massages. So this way, I'm just able to build on what I've already learned. So it'll be helpful to my clients.
Good. Brad, what about you?
I decided to get into massage therapy because I've always really enjoyed giving massages. You know, I haven't really had any education before, but I really enjoy helping people feel better. I've been in the caregiver field for a little while now, so it just kind of rolls into it, the whole caring for somebody and make them feel better.
When you got into the program first, what were some things that maybe surprised you about what you had to know that you didn't know?
There's a lot more knowledge about massage therapy than what I figured. You know, it's not just like, oh, you just rub on somebody, and it's a lot more than that. You have to know all the muscles and, you know, how different things affect different areas of the body, the contraindications, just what to look out for.
And you'd mentioned that you're interested in already working in the caregiver community. Is that something that you think supplements or complements the work that you do already in that area?
I think so. I've always been a really caring person. In the past, I've done several different jobs before. Once I got into the caregiving field, it just really brought me into it. You know, I really enjoy helping people out, people that can't do things for themselves, like with disabilities. It's just a real rewarding feeling being able to make somebody feel better.
And what about for you, Stephanie, going forward? Where do you think that this may take you, this certificate and associate degree?
I don't know. I'm just going to sit back and enjoy the ride.
Have you learned anything that has maybe made you think differently about another aspect of massage that you hadn't really thought about before, or a different modality that you might work in?
I would really like to learn as far as the massage for headaches And then also, I would love to learn how to do it on children and newborns.
Mm-hmm. So what about you, Vangel? From your point of view, when you came into the program, have you been sort of excited by something that you never expected to learn?
Yeah, just like Brad said, there's a lot more stuff that people do not understand about massage that there is to it. All the different ways of massaging, all the different types of little things you need to worry about. And with that is I mainly want to focus on the deep tissue massage formation and kind of basically working with either, if it comes down to it, with either like a hospital or a chiropractor, or even if it comes down to it, even working for myself. So, yeah.
Kristen, what about you? Is there anything that you've learned as you've gone through the program that like sort of maybe made you think about something specific that you might like to learn more about?
One thing I really want to learn more about is aromatherapy and the benefits that like essential oils have. Tamla was talking earlier about how like massage is like the original medicine. Aromatherapy is a lot like that also, using natural resources, not like Tylenol or ibuprofen.
Can you talk a little bit about the physical demands on your body being a massage therapist?
Oh my gosh, it can be really intense. Right now we're in the middle of our clinicals, so we do 3 one-hour massages back to back, and for us, just learning how to do this, that's kind of intense a little bit, but we've kind of gotten used to it. This is our last week, so I feel really confident now being able to like go and do like massages back to back.
Mm-hmm. But Vangel, there's a sort of a limit to what you can do. I mean, you couldn't physically do 8 hours of massage a day, could you? Really?
I mean, it all depends on your body. If you got good body mechanics and you taking care of your body, you're being healthy, you're exercising, I think anything is possible if you just put your mind to it.
Is that part of the training, though, as well, as you begin to develop as massage therapists and professionals, that you begin to have to understand how to hold your body upright and how to bend and how to do all the things?
Yes, I definitely agree.
Have you become more health conscious as a result of being in this program?
As far as my body and the way my body works and what I should and should not do concerning my body, yes, I agree.
As happening for cosmetologists, I mean, I always, that's a lot of stress on the body and standing. Have you developed good habits and techniques as a result of being in this program?
I actually think that I have. I've changed a lot of ways, and to me, I mean, when I first started, I really thought that it was going to be a lot of hard work, but you're using your core more than you are your hands, and I think people don't realize that. And after doing the clinicals, as Kelsey said, it's amazing. You really think that you would be so worn out that you wouldn't be able to do anything, but body mechanics has a lot to do with, and how you take care of yourself really has a lot to do with it.
Brad, have you found that that massage therapy is now something that you're thinking about as part of your preventive medicine and well-being for yourself?
Yes, I am a lot more aware of, things that I do on an everyday basis that I could perform better to help prevent injury upon myself. Like they've said, body mechanics is everything. If you want to continue to do massage 15, 20 years down the road, you have to master body mechanics and work from your core and not try to use your strength. I've been hearing that a lot. You need to work with your core, not with your main strength.
So Kelsey, is there a way in which you feel as you're doing this yourself to help somebody that it also is helping you, that there's a reciprocal effect as you're doing it?
I believe that there is. After a massage, I just feel really relaxed. I feel I feel good. It feels good to know that you help somebody else.
Well, I think that's a wonderful note to end on. I want to thank you all so much for being here. I wish you all the best as you wrap up your program on the certificate level, and for those of you going on to the associate degree, I wish you all the very best. Thanks so much for being here with the Parkland Report.
Thank you.
Thank you.
Thanks. That's it for this edition of Parkland Report. We'll see you back here next time.